Thanks, Satyen, for this opportunity to talk during the AOS session on this important area. I mean, it's all basically about how do we help the organization grow or your practice grow. So this is the most important thing, because if there is one challenge for any organization or any practitioner, it's about growing the volume of the patients they are seeing every year, year after year. So that's something you cannot afford to lose. So in that context, connecting with the patients becomes very, very important. So I'm just sharing a study that was done in America by an organization who wanted to know how the patients choose their hospital or a provider. So they gave multiple options, saying that it could be friends or your family doctor or your employer or your insurance company, or it could be news advertisement or what you see in the TV. But they also said, you give a kind of you market whether that is very believable, that information you get from that particular source is very believable or somewhat believable, not believable, not at all believable. Okay, so that is how they wanted them to mark each of the source of the information. So what I'm showing here is the data which is very believable given by the patients. So as you can see here, when the patients get the information from their family and friends, majority of them believe it. Next is the individual doctor, or could be a family doctor, or then the employers come. Employers and the independent organization that evaluate health plans. Being in America, there are also a lot of reviews which are put up by various organizations. But if you can see, the least believed is the newspaper and the TV, the information. So it all comes down to, when it comes from family or friends, people usually share their own experience. It comes from their experience. When it comes from the family doctor, it's about the clinical competence of the team which is running that particular organization. So these two becomes very, very important. So one is the experience they get is important. The second is the clinical competence of the team is very important. So as a result, here, if the patients have to have a good experience, each interaction with the patient is a moment of truth. So when a patient comes into the hospital, everybody, now we have a security, then they have to go through a reception, a medical record department. They are seen by an outpatient nurse or an optometrist, then the doctor. Some of us have, many doctors have today about 8 to 10 people supporting them in their practice. So interacting with each one of them, the experience they have with each one of them is a moment of truth, and the whole team have to really understand that they have to equally contribute. One person not doing it well is going to break the whole, whatever the efforts put in by others. And this also gives an opportunity to really connect with the patient, not only just for the doctor, but everyone in the organization. So the one way to connect is, how do we address them? How do we take care of their dignity at all levels of interaction is very, very important. For some of the senior nursing staff and the doctor, it is important that they connect with the patient during the examination process. At least spend 1 or 2 minutes to know who they are, who that person is, where is he coming from, what is the job he is doing. And if you can just try to understand, it will be, it really helps to connect with the patient. It is also useful at some point of time. And now once you do that, you also you create a better trust and a better relationship with the patient, which has got an implication on compliance and acceptance to the treatment. And again, even something goes wrong, the chances of a medical legal issues all become very less. And these people also can be very supportive of the organization. So this, one is clinically we need to examine, understand, make a diagnosis. All that is important. Dr. Kiran gave a nice talk about the glaucoma. All that is very, very important. But if there is no other communication, if everything is wrong, fine, he is not going to communicate it to that patient. Only if there's a pathology is going to communicate. That's not going to really go well with the patient. And again, the other other point where we really connect with the patient is helping the patient to make a decision, helping them to get a informed consent. These two are really important, and there is a lot, either the doctor or the counselor or the OPD nurse can connect with the patient, because if you are able to make that happen, that is both the informed decision making, what kind of an intraocular I'm going to get, what kind of procedure I'm going to get, not just cataract, even glaucoma today I got several options of treatment. And getting the informed consent where the patient really understand all of that, really ensures a better compliance to treatment and follow. And again, we always, there are chances, 1 in 100 or 1 in 200 chances that there will be a crisis, which can be a complication during surgery, or that maybe something may go wrong systemically. We may have to shift the patient to another place. So during this crisis, the patients will be agitated, the relatives will be agitated, but we need to be calm, patient, and really compassionate to the family. Now we have to really meet with the patients' families and relatives and face it. So that is again another way of connecting with them, and mainly to let them know that we are really doing our best to take care of the patient. So there are some people who delegate that, or they may not even meet the patient or the patient's relative at a time of crisis, which should not happen. So basically, these are all, there are some examples where we can really connect with the patient, and as a result, they improve the trust on us or trust on the organization. These are all happens when they are there. And again, it's if we really want to provide a good quality, whether clinical quality or service quality, we have to really understand from the perspective of the patient. So hence, getting a feedback from the patient is very important. This is another way to really connect with them. This can be a direct survey, or could be a phone-based survey, or sometimes when you come across a problem in your surveys, then it also requires an in-depth review to understand that particular problem. And again, one is we connecting with them. Sometimes they also connect with us. They call us to find out, for some clarification, or for changing the appointment, or to clarify the post-operative instruction. But sometimes we neglect it. But if you can create a system to respond to all these calls, if you organize yourself, who's going to take the call, what kind of a thing this particular person will handle, and what are the calls that will be escalated to the next level. If that clarity, a system is there, it is always better. And just want to share, in our organization, even covering 1% of the population is a huge task for us to get the interviews, the patient feedback. So we looked at the option of sending an SMS. So when we sent it about SMS, we were able, of the 4,315, OPD patient in a particular clinic, that's a cataract clinic, we were able to send it to 4,150 because of the correct phone number and all that. The certain number got delivered, and only about 3.6% of the patients responded to that. That's really a kind of a good number. So, and when you look at it, about 71% of them said excellent. Okay, and then 1% and another 4% said we are either average or poor. So you need to really look at why they said excellent. What is our strength is also we have to really understand. And why they gave us a grade, average or a poor, which is our weakness also, is equally important. So when you ask them why they were happy, you can see the highest score goes to cleanliness. Now you don't think about it. So even maintain, if the housekeeping staff knows, this is being rated high, people are giving us a excellent score just because we are clean. They will do their job also in a much better way. And all the other three are the nursing care, and the doctor's care, and the counseling. So this feedback to our team really will make them understand, if they really do the job well, then the hospital and the organization is going to better score. The other things that people may not really think that is important. Otherwise they will be happy, but there's one reason they given why it is excellent is this. Similarly, when it comes to why they are not happy, this 4 average and 1 poor, majority of that relates to the waiting time. So here, again, the operational efficiency becomes very important. So here, where, understanding the patient flow, how am I going to structure the flow so that, the waiting time is not going to be it will not be a problem. How I can see, let's say I get about 20 patients or 10 patients per hour. What is it, the resources I need so that all these 10 patients can be seen within 60 minutes? What is the manpower I need? What is the infrastructure I need? So you can put a number, whether it's 30 minutes or 60 minutes or 90 minutes. Typically, many, if the patient interactions takes anywhere between 30 to 45 minutes. Like, you want to do a auto refraction, a dilatation, then maybe, basic investigations like intraocular pressure, BP, and doctor's examination, counseling. All of that should not take more than 45 or 50 minutes. Maybe adding another 15 or 20 minutes should not be more than 75 minutes. If you can keep 75 minutes as your service time, and because this 75 minutes, at least 75% of that time they are all engaged, so they won't feel that they are waiting for some service. So if you can define your service standard and whether you have the adequate manpower, adequate space for the people to wait, then that really take care of that. So each way you try to understand what is the problem, why they were not happy. Somebody can even call these patients, their team, to understand why they felt, why they are dissatisfied with the doctor's care or the nursing care. If you can find out, that it becomes much better. And in Aravind, we also conduct at least every day one or two, this what we call as a focus group discussion. So we have trained social workers. They sit with a group of patients, not usually, typically about 10 to 15 patients, and have a conversation with them as to what they like, what the problems they are facing, how is generally their experience. And we also encourage the doctor, at least one or two doctors and the paramedical workers, to sit in this discussion. And this discussion is also recorded. Audio recording of that is done. Anything good, anything bad is also shared with the department later with the feedback. For example, if you see, and I'll just play an audio. Volume, hello? Okay. Audio வருமா? அவங்களுக்கு இவங்க எஸ்ஏ வைக்கிற மாதிரி சொல்லிடுறாங்க. அது திரும்ப இவங்க அவங்க யோசனை ஒவ்வொரு மருந்து எடுத்து யோசனை பண்றாங்க. புரியுற மாதிரி ஒவ்வொரு மருந்து எடுத்து. Just to give you an idea that 1 minute. That we actually record it and share it with them. So when they if the a management team telling the staff is different, if the patients telling the staff is very different. When it comes from the patients, they really take it much more seriously. And then it could be either a complimentary message or it could be a complaint. We need to share both with the team. It's also important to understand how the patients review you or rate you on a social media. So these are all freely available. And then we download this and circulate it to all the hospital CMOs. And every month this goes. And any reviews or comments is also, if it is important, we also track them. And I mean, usually if it's a bad comment, a bad review, somebody will call them. We'll try to find out. Every day somebody looks at it, what is happening on the social media, how we are being reported. And they'll also connect with the particular patient, but it's also shared with them. So the real benefits is that it is useful for tracking patient experience in the remote centers. Aravind also runs about 108 vision centers, where it is all run by the optometrists and the ophthalmic assistants. Calling them, we try to understand. Then we also call one or two patients who bought the medicines or the glasses, or they've undergone surgery. Each one, we've got a certain proportion of patients who have to be called. And this enables to the whole thing, whole conversation. And there is also a scoring system, and which we share it with them. So this helps our staff to understand the patients. And we can also train the staff in a communication skill and align them with the vision and values of the organization. So all of this, feedback, changing the behavior, improving the communication, all helps to improve the trust in the community and overall helps in sustainability of the organization. And sometimes their feedback also helps. We normally used to give an eye drop with the sticker stuck on the outside of the bottle in the pack. So it used to be like 2 and 1, and you see that this is not on the bottle. But when the patient suggested that you also put it, sometimes that is more useful than having it outside. So now we do it both, so that the patients really understand, because they only understand bottle number 1, bottle number 2, how they have to use it. So this is from a suggestion from a patient. And again, there's some of the patients find it. We give them a wheelchair. We don't have an attender. Only the patient's attender have to, push the patient also wherever they have to take them for the OPD consultation. They said, no, if you can provide a bell. This particular patient sent even the bell by courier. So we fixed it, and then we found it useful. Then we fixed it for all the other things, so that this patient attendant need not shout, or the patient need not shout to the other people to move away from their path. Just to, even something very small, will really help the patient to appreciate your services. Sometimes these patients, also become our camp organizers. Some of them come and we develop a rapport with them, and we know that, he's heading some social organization. We also request whether they can do an eye camp in their area. So, because we also found, Aravind doing it on its own, eye camp in an area draws certain patients. But if there's a local partner involved who's trusted by the local community, then the overall turnover of patients to the camp is also much higher. And if there are any problems, any issues, anything goes wrong with the patient, even sometimes death, these people are there to support you in the community to face the whole thing. So that way, these patients, these also can become ambassadors. Sometimes, this is a patient, who had a very good service, said that, now our entire family has pledged to do eye donation. So to that level, our services can move them. This is again, there are people who are our patients. These are all our patients who are involved in inaugurating our vision centers. So we always find the local community partners who are involved in doing it. Sometimes, we have somebody donating to set up these vision centers. They may not be the people who will be opening it, but it is a local, the people who are important in that area, the people who are inaugurating them. So to conclude, there are connecting with the patients at different levels. It helps to connect with the community. It helps to support the outreach program. We can do a lot of awareness program. We also do on and off. Once in a year in those vision center area, we do a awareness program. It also support in the organizational expansion and in the growth. Connecting with the patients have to be driven by value. Patients really appreciate the way how they are cared and respected. And they really appreciate knowing that, they'll get the same good care regardless of their status. So while we connect with them, it has to be really based on the compassion and equity which have to be practiced by the patient. Just because, we connect, we know that somebody is important, does not mean that, we have to give a less, treat other people in a different way, or neither that particular person has to be treated as a VIP. So we need to make sure that these values, these connecting is not with some ulterior motive, but it has to be driven by the compassion and the equity. And Dr. V really puts it in a very nice way. And he says that when we identify ourselves with all that is in the world, there is no exploitation. We are not. So the whole the principle in any practice should be not to exploit our patient. And if we feel that it is ourselves we are helping, it's ourselves we are healing, then we really truly connect with the patients. I think bringing about that change within the team is the responsibility of the leader. And if the leader can do it, that everybody in the practice, in the organization, really enjoy their time, they work in the organization, and there is a good harmony, and there is overall growth in the organization as well. Thank you.
Thank you, sir. I think these sentences are extremely important. It is ourselves we are helping, it is ourselves which we are healing. is a kind of a statement which we have to really relish to really understand that. I think it comes over a period of time, rather it's just one day, but it's not so.
Yeah.
And when we are there in the organization, like Arvind, in a big way, that we just become routine. But once you start practicing, every one of us have really started understanding how we have to really connect with the patient rather than just sending it in a kind of newspaper ads or whatever. We haven't seen anybody coming just for the sake of newspaper ads most of the times. And in fact, there's a distinct difference in we giving it advertisement in the newspaper versus the, say for example, the Chennai Silks giving an ad or other commercial people giving an ad. They seem to be getting well connected through the ads rather than the patient, the healthcare system getting connected with the things. So some of the doctors have sent a message on the WhatsApp group. Still, I thought it is more of a promotional thing from the doctor to doctor than as a patient we get connected to the other doctor. So it looks very, very essential for all of us to understand getting connected with the patient is going to be the key factor for helping them as well as we growing in our own whatever the practice which we are doing. Thank you so much, sir.
Thank you. Thank you. Any
Any-
questions I can take because I have to go to another session for a meeting.
Thomas and someone
Any
else, sir?
comments?
Kiran? I'm not sure about madam's name.
Okay, thank you. Thanks a lot.
Thank you, sir. Thank you.